So I picked up 3 important words from the seminar today. The first was donkey, the second was unicorn, and the third was Rocky. Now I've made a substitution here. I'm substituting Iron Man now for Rocky, so bear with me. First of all, when we talk about digital transformation, we can get all caught up in the new technology. But let me just say, this stuff isn't really very new. The digital age started in 1947 with the invention of the transistor, and AI, the first conference on AI was at Dartmouth in 1956. So we're not exactly plowing new ground here, although it's challenging. But I think as we look at the horizon, it's really easy to see that there is some perfect, flawless future out there. As you've talked about today, I know we're a little skeptical about that. But I think if there are 3 things that we might want to do, I'm going to start with unicorns. But in apologies to 7-year-olds, I'm going to talk about dead unicorns. Think about 2 companies. I don't know how many of you know what a dead unicorn is, but a dead unicorn is a company that was valued at $1 billion or more and then went bankrupt. Think Theranos. It may not have been as big a deal here as it was in the US. It's a technology company that basically was a bright new shining object, and a whole bunch of people now are in jail because of that. So not getting too caught up in bright, shiny things without being really careful to make sure that we don't end up with a dead unicorn on our hands. But let's say, and I think it's pretty likely that the NHS is not going to end up with a dead unicorn in the digital transformation, and we avoid that trap. And then the second thing is, I think that's where we get to donkey. Now, I don't know how many of you remember the movie Shrek really well, but at one point, Donkey is in the onion carriage with Fiona and Shrek. And he keeps saying, when are we going to get there? When are we going to get there? That's a little bit like our workforce trying to say, when are you going to get us this implemented? When are we going to finalize that? And Shrek eventually says, no, we're not there yet. And so making sure that you bring your workforce along and recognize that they have real concerns, and we've talked about that some today, and to go with that and be patient with that, because we will definitely get there. And then finally, getting those 2 things right, I think the way to think about where we're headed is, again, a little bit like Iron Man, okay? You've got Tom Stark. He starts to build technology around him. So I would suggest we keep the people in this with their hearts and their minds, but we use this technology and our transformation as more of that exoskeleton to do the heavy lifting. And so, Nina, I'm going to let you make this a little more practical.
Thank you, Margaret. And I think those analogies give us a really memorable way to think about our digital journey present, but also our digital journey ahead. I want to just briefly build on that by drawing on what we've actually heard today and what it means for the next phase of the NHS digital transformation. And for me, 3 key reflections stand out. So we've heard that digital transformation is here to stay, and safe execution is key. The challenge is no longer whether innovation exists. We've heard today there is so much innovation. It's really now preserving that innovation and moving from pilots to delivery, and actually realizing the true capability and impact it has for our patients and also for our teams. Second, we've heard that the importance of digital transformation landing in primary care and neighbourhood health. As Professor Claire Fuller said earlier this morning, general practice is the cornerstone of primary care. It's where access begins, continuity and prevention is built, and pressure is felt every day. But we find solutions. We're all innovative. Every single person in this room really is very innovative, and we should focus on system-wide change to help deliver impact to our patients and our communities. We need to remember the levers for change. So why are we doing this? We are wanting to release time, create capacity, and support a better working environment for our team members and our colleagues to be able to get through each and every day. And it has to be clinically safe. We've heard lots around governance today and clinical safety, ensuring that whatever we implement at scale is truly has the governance around that. So For me, working together is extremely important. There's lots of synergy around the room today, lots of energy around the innovations. Let's not try and duplicate. Let's use the lessons learned that we're experiencing practically in the day-to-day and try and scale and have some powerful solutions that really can make a difference. So, as we leave today, the challenge is not simply to say, well, that was interesting. The challenge is to ask ourselves, what are we going to do differently next? What's the one idea that we're going to take back to our practices, to our teams? What barrier can we help remove? What partnerships can we try and strengthen together? Because ultimately, this is about two things. Better care for patients and improving the working day for us all and our team members as well. So thank you very much. Those are our reflections for today. Let's keep the momentum going and keep engaging, and we look forward to the next session.